The coronavirus at the center of the current pandemic SARS-CoV-2 is spreading like wildfire. Just 4 months after it was first detected, it has spread to over 180 countries, infecting more than 1 million people. At this moment, at least 20 vaccines are in development around the globe, but there's still so much we don't know about the virus, how it spreads, how it affects its victims. The following cases shed light on why we should remain cautious about this slowly unraveling mystery. I'm Serena, and welcome to Facts Tell. Case number 1. A 4-year-old female Malaysian tiger tested positive for coronavirus after developing a dry cough at the Bronx Zoo in New York City. Samples were taken and tested after the tiger and 5 other big cats at the zoo began showing symptoms of respiratory illness. This is the first case of a wild animal contracting the disease from a person. The zoo said it is not known how this disease will develop in big cats since different species can react differently to novel infections. Shocking, but not completely surprising. It turns out that SARS-CoV-2 can hijack animal cells too. Case number 2. Not only is there uncertainty about who can be infected, but how they are infected. We're still learning about transmission. Just days ago in Wuhan, the epicenter of the outbreak, a new confirmed case sparked an intense debate online. An asymptomatic patient was unaware how he contracted the disease. He acknowledged picking up packages without wearing gloves or washing his hands afterward, which stirred a panic as residents thought of the numerous packages we pick up every day, especially with many stores closed and a heavy reliance on deliveries. The patient clarified that he also went shopping, fixed his car, and picked up multiple deliveries, but he still had no idea how he got infected. Like he said, "How did I get it? It's like a mystery." Case number 3. Silent carriers or asymptomatic patients are those who were infected with the novel coronavirus but have shown delayed symptoms or none at all. However, these cases can cause sporadic clusters of infections. The first confirmation that COVID-19 could be transmitted by asymptomatic people came in February when a case study described a 20-year-old woman from Wuhan who passed the coronavirus to 5 family members but never got physically sick herself. And this raised people's eyebrows and accelerated checkups, especially in Wuhan, where, according to one respiratory expert, there were an estimated 10,000 to 20,000 asymptomatic cases. It's now dawning on people, maybe we don't know as much as we thought about this new virus. Or, in the words of China's top medical scientist, we're not being imaginative enough about the novel coronavirus. Well, he may have a point. Epidemiologists are still trying to figure out which species can harbor the virus to gain a better understanding about where it may persist in the world and how likely it is to jump back to humans in the future. Since COVID-19 still holds so many unanswered questions, we might as well give up on panicking and instead remain cautious.